Good morning, good afternoon, greetings and welcome. I know we have people joining us from other places in the world and all over the globe. I don't know what your time zone or what your weather is like, but I hope it's pleasant and you're enjoying whatever time of day it is for you. We're so pleased that you could join us today as part of Admitted Students Week. We're going to have a dynamic discussion with some outstanding members of our Brown School faculty. So before we get started, little housekeeping. Everyone's on mute right now, but later on we'll have time for Q&A. You'll be able to drop questions in the chat. And also during Q&A, we'll invite you to take yourself off mute to raise your hand and answer some of your questions. I think everyone is here who is supposed to be here. We did a little I did a little glancing for a roll call. So I'm going to go ahead and get started. Greetings, my name is Atia Thurman. I'm an assistant teaching professor in the Office of Field Education at the Brown School, and I'm also a very proud Brown School alum. And I'm excited to be here today with you during Admitted Students Week 2022. And I'm really excited to be here with some of my, I can't say favorite colleagues, but yes, they are favorite colleagues and dynamic members of our faculty. And we are here to talk about from clinical to policy practice, social work and social policy at the Brown School. We are a community of learners, thinkers, practitioners, and leaders. Collectively, the intersection of our work in clinical, research, and policy practice come together to create real change and impact. It's my pleasure to introduce to you today's panelist. All right, so excited. So up at the top left corner, you have got Professor Fred Semawala. He is the William E. Gordon Distinguished Professor. Professor Semawala leads innovative interdisciplinary research that informs, develops, and tests economic empowerment and social protection interventions aimed at improving life chances and long-term developmental impacts for children and adolescents impacted by poverty and health disparities in low-resource communities. He holds a joint appointment in the Washington University School of Medicine and directs the International Center for Child Health and Development, also known as ICHAD, and Smart Africa Center. ICHAD recently received a 5-year, $5 million NIH grant for global health and research. Put your hands together for Professor Semawala. Now it's my honor to introduce Anna Shapson. Anna Shapson is a two-time recipient of the Brown School's Excellence in Teaching Award. Professor Anna Goldfarb Shapson is passionate about issues related to privilege and oppression and their interplay with politics and policy. She serves as the chair of the policy specialization and is a frequent diversity trainer and facilitator at the school. Professor Shapson oversees the university's joint degree JDMSW program and serves as a faculty advisor for both MSW students and joint JDMSW students. She is the university's safe zone trainer for all faculty and staff. Shapson is also an independent diversity consultant, having designed and facilitated workshops for many notable clients, including Twain Financial and Kaiser Permanente. Prior to joining Brown, she practiced law for 10 years. Thank you so much for being here, Professor Shapson. It is my pleasure now to introduce Barry Rosenberg, Professor of Practice. Barry Rosenberg's passion is preparing the next generation of social work professionals to obtain positions where they can effectively lead and manage human service organizations. His scholarly work is grounded in a 37-year career in nonprofit leadership and nationally recognized innovations in strengthening human service organizations. He is the chair of the Social Impact Leadership MSW concentration, teaches courses in leadership management, including Brown Consulting, and integrative capstone where student teams assess service organizations and present recommendations. He also directs the Center of Human Service Leadership, which provides organizational capacity building services to nonprofit tenants at the Del Mar Divine co-location site. Thank you so much. And I'd like to also welcome to our space Professor Pamela Begay, Associate Professor of Practice. Pamela Begay's work focuses on American Indian tribes, and her research interests include cultural identity and issues surrounding Native women. Her long-term goal is to teach and mentor the next generation of social workers and maintain her private clinical practice. Since joining the Brown School in 2022, Begay chairs the American Indian Alaska Native concentration and serves as a faculty associate for the Booter Center for American Indian Studies. She has taught undergraduate and graduate level social work courses and maintains a private practice focusing on treating trauma while influencing psychodynamic therapy. So glad to have you here. And my colleague, I am thrilled, coming to the stage is Elizabeth Fuchs, MSW. Elizabeth is passionate about intersectional, anti-racist, and anti-settler colonist policies and deconstructing systems that perpetuate white supremacy culture. As a native St. Louisan, Fuchs contributes a local perspective to the social justice movement in the area. In her previous role as manager of public policy and lobbyist for Promo, Missouri's statewide LGBTQ advocacy organization, Fuchs learned the value of navigating policy through a theoretical social work lens. By recognizing the importance of relationships in advancing policy, social workers are uniquely trained to relate to, connect to, and empower. At the Brown School, Fuchs is the field advisor for the Master of Social Policy Program and Social and Economic Development field faculty in the Office of Field Education. She also teaches social policy analysis and evaluation. Could we all put our hands together for that amazing group of faculty that are with us today? Thank you so much. All right. So before we get all of our panelists and our faculty engaged in a conversation, there's just a few, I want to set the stage a little bit. I want to frame the conversation, if you will. And today's conversation is about macro, meso, and micro, and how this intersection of these three levels of social work, micro being person in their environment, meso being small and mid-sized group organizations, and macro being large-scale systemic reform. The intersection and the way they interplay, because when you come here, you may be focused in one area, your career interests may be focused on one area, your training and education and coursework, but we really want you to appreciate how dynamic they are and how they work together. So all three of these levels, they inform each other. And depending on your concentration or specialization, the curriculum may skew more micro or more macro. For example, you may be more clinically focused in coming into children, youth, and families and become a school social worker. You may go into mental health and want to do counseling and therapy. And then at some point in your career, it may, we hope that you're sort of always thinking of those three levels in the way they're at work, because at the same time, a couple years into clinical practice and you may be like testifying on behalf of a policy, you may be part of advocacy at this macro level. You may be starting your own organization, right? And that's a meso level. So no matter what concentration, you'll be exposed to all three here at the Brown School. I love this. Just a little, appreciation for how they work together and how they inform each other. And so when you're thinking about micro, careers in micro level may look like clinical practice, what I said before, direct practice, school social worker, military social work, clinical intervention, integrated health specialist, medical social worker, and case management. And this is at the micro level, as you can see, person in their environment. This is when you're dealing really directly, directly engaged with clients, with humans, with people, with their needs, with helping them to have better quality of life. And then at the meso level, some careers you may see at the meso level may look like community program coordinator, asset manager, civic engagement organizer, educational administration and leadership, and organizational leadership and social entrepreneurship. I'm looking forward to hearing from some of my colleagues talk about what this looks like and at this level, especially with our concentration in social impact leadership. I think that's where you're going to see a lot of the coursework. And if you're interested in this, then that may be the concentration for you. Whereas micro, you may be looking at concentrations such as mental health or children, youth, and families, or violence, injury prevention. But they all interconnect, so keep that in mind.
That Sarah Josafu will be called before the privileges committee.
Okay, I've got a guest speaker.
Then push us come to shove that right now there.
Okay, all right. And then at the macro level, we're looking at that, great. At the macro level, you're going to see policy analyst, lobbyist, foreign affairs diplomat, yes, international agencies, government agencies, and research. And so also so many colleagues who are operating at that level too. I think what you're going to find interesting is that throughout your career, hopefully you'll have the richness of intersection, of finding that intersection, of weaving all of these together. over time, and you're going to hear from faculty who have done just that. And then, all right. So just to give you a sense, we're looking at the big picture together. I'm hoping that some of you are seeing your career interest here and you're saying like, that's something I may want to do, or that's something I may want to explore. And we're going to help you do that a little bit more while you're here. All right, I think at this time, I'm going to close out my screen sharing. I'm going to try to, here we go. And if I could have all of the panelists, yes, okay, quick roll call, I can see. Elizabeth, great, okay, you're all here, thank you so much. So I have a set of questions that I would like to ask our panelists, and then we're gonna have time for you to have questions afterwards. All right, I would love to hear from each one of you. And I have, the first question I have is, can you describe the type of work that you do and how that work applies to one or more levels that we just discussed? How it applies to micro, meso, or macro? I tell you what, I'm going to go in reverse order. I'm going to shake it up unless someone wants to go first. Do I have a volunteer from our panelists?
Yeah, I'll go.
Yes, so, great. Thank you.
No, that's fine. Thank you so much. Let me just introduce first of all, you are all welcome and congratulations on being admitted to Brown School, the same school where I went. I came from Uganda. That explains my accent. And I did my master's here at the Brown School. Then I finished my master's. I loved them so much that I enrolled in the PhD program. They gave me a wife here at Washington University. And then I left Washington University. I went to Columbia University for 15 years. But because I loved Washington University so much, I came back. So I've been back here for the last 5 years. So that's how good, you get addicted to Washington University and to George Wayne Brown School of Social Work. So the work I do is around social protection, is around economic empowerment, and I'm a social worker, but some people define my work in terms of economics, in terms of public health, which is okay because it cuts across. Now, just to answer Atiya's question, my colleague Atiya's question, really, my work cuts across all these different levels. And so when I'm working with children, and I'll talk about the work I do, which is global, but also domestic. When you are working with children, you can't, so when I'm enrolling children, I enroll them through schools, okay? So I want to get to individual families, but I'm enrolling these children that I work with through schools. And you can't get to the schools already, that's already a meso level in a way, if you can think about it that way. So because, the kids are within a family, that's very micro, but the schools are that next level. You can't get to schools unless the Ministry of Education or the Secretary of Education in these other places gives you permission to engage with the schools. So you don't just walk in. And now I'm talking about the developing countries in Africa. Also in New York, when I worked in New York, I wrote a proposal around working with foster care kids who are in the foster care system, who are transitioning from foster care into independence living. But without going through the New York City government, you cannot get to those kids. You cannot. So I think the point I'm trying to make is it's necessary for us to know how all these levels really interact. Even if you are going to be a clinician, sometimes you may never know how to work with the families without knowing even the resources that are available to them at the policy level. That, here I worked with Peterson Housing. And when I work with Peterson Housing, the question is, you are helping people build credit, okay? But so you are working with an individual family. But at the same time, as you help them build credit, there is a welfare system sometimes that makes it hard for people, low-income families, to build assets. And so how would you advise them that, look here, if you save so much money in an account, your benefits may disappear? So those kind of aspects, really, you need to know how policy informs how the policy will inform your practice, and how it will inform also the community partnerships that you're going to build. I know I didn't talk specifically about, about each individual piece of my work, because I know that we don't have a lot of time, but I wanted to show you that both in developing countries, for those who are interested in global work, but also in this country itself, that you really need to understand how to interact with the families, but using a policy lens and also a meso lens.
Absolutely. Thank you so much. And I think that sets up well, maybe to transition to ask Elizabeth this question on Professor Fuchs, since you operate also at this policy advocacy level, if you want to chime in and answer the question. Also, a quick plug, I have to say, Professor Samawala mentioned Justine Peterson Housing here in St. Louis, which is one of our practicum sites, and also where I did my practicum, 20 years ago. So yes, it was good to hear you say that. Transitioning to Elizabeth, there you are.
Definitely, thank you. So yes, I work at the intersection of macro and micro in a very unique setting, which is kind of community healing and legislative strategy for our queer people and for our local and state elected officials. So currently in Missouri, we are facing two very dangerous anti-trans bills here in our state capitol. And so I've been working as support, social work support, to trans kids and their families as they go to the Capitol here in Jefferson City in our state in Missouri and lobby for their lives, basically. Some of them are as little as 6 years old. And so what does social work support look like to these littles who are in there telling elected officials about being bullied in school, or how come they would like to play sports or go to the doctor? And so I've been providing social work support through Promo, which is my former employer. And so we bring these little kits of Play-Doh and crayons and markers and essential oils and snacks and feeling wheels. So after the kids testify, after their parents are testifying, we went into a senator's office and we talked about feelings and how those things came up and treated their shock. And so really helping to process those emotions that come with testifying and bringing that level of micro social work support at that more direct practice level to a policy space like the state capitol. And I feel like those kits and the feeling wheels are the ways that we bring that kind of that intersection together, the community healing and the policy work. That's just one aspect, I believe, that social workers are really uniquely positioned to provide, and how those things integrate together. And then bringing that into the classroom in the spring, I teach the LGBTQ practice class. And so we get to bring that real life experience of what's happening in legislation with queer people to our community practice class.
Thank you so much. Thank you so much for that. Can I transition over to Professor Shapson, because you also are working in this space too, so lots of synergy here.
Yeah, and I think it's interesting to go right after Elizabeth, because we've both spent a lot of time lobbying on this hateful anti-LGBTQ legislation that the state of Missouri and similar situated states seems to do, but different. And I couldn't respect Elizabeth's work more, but it's not what I do. I am not as nice and feeling wheels. And even though I know some of those kids who you've helped really well, I am going to be more focused on how you manipulate the system for our own advantage. I don't care as much about feelings, but not that I mean, but I'm a lawyer and I really want to make sure that you understand how to work in this space and how to write briefs, how to write testimony, how to lobby, how to work in the executive branch and do advocacy in the judicial branch, how to understand economics. And I guess one of my really big things that I say a lot in class is let the passion bring you to the work, to the store, to this classroom. But then once we get in here, the logic of how we manipulate the system has to take over. And so that's kind of the directive focus I have in my class. So you're not going to get we need to take care of you, but Elizabeth will give that to you. And not that Elizabeth also doesn't understand lobbying as a former lobbyist, but I will give you more the how do we manipulate. So it's a nice 1-2 punch with us.
Thank you so much. That's absolutely true. And I'd like to bring into the space, can I hear also from now Professor Pam Begay about, what is your work and at what level does it impact and intersect?
Sure. Thank you all for being here and for welcoming me to the panel. So I'm coming from 20 years of both clinical practice, mostly clinical practice, as well as academia. My private practice focuses on individuals, families, and couples, which also has involved court systems and foster care systems. So there's that mezzo piece as well. So I work with many clients on trauma-related struggles. I use EMDR, somatic experiencing, while weaving into the therapy psychodynamic theory. Currently, I teach the contemporary theories and issues in behavioral health, and this course touches on historical aspects of mental health, historical trauma, and issues that we become aware of as we are in practice and as we are interfacing with different systems in the profession. So we are starting to begin to learn about the theories, and students are gonna start internalizing and utilizing these in practicum. So this course specifically, the theories course, is really designed to allow our students to take that active stance in their learning. And there's a lot of emphasis on group work, as we know that when we're out and about in the profession, we will be working with people, groups, communities, advocating on their behalf. So it's a way of building community while they are in this cohort here at the Brown School. I also do chair the American Indian Alaska Native concentration. So we just want to ensure that we're staying up to date on lessons learned in our field while also honoring our past. So there's, we can speak about that later as we move along, but just really looking at ways that, as I was thinking about all of the systems that I've been involved in through the 20 years. So it's touched on many of those, the list that you had up, Atia. So I really appreciate that. And I know that social work is such a broad profession that there's room for all of us. And there's certainly room for continued growth and lessons learned. So thank you.
Absolutely. I appreciate that. There's room for us and there's a demand for us.
Yes.
So now I'd love to pose the same question to Professor Rosenberg, who I know has such a unique perspective on this. So I'm excited to hear from him.
Thank you, Atia. And let me just welcome and congratulate all of you on acceptance. Looking forward to meeting all of you soon. So my work has been primarily focused on the meso level. 37 years leading organizations, larger organizations. If you're familiar with United Way an organization very much like that, raising and distributing money to other organizations. I will note, because I think this is really important, that I started out thinking I was going to be a marriage and family counselor. I would have been terrible at it. But that background is incredibly important for meso work. And I'll touch on that from two levels. One, organizations are the vehicle by which we provide services in most cases, unless you're an individual practitioner with your own office. And so I see a lot of what we're about is how do we facilitate the ability of skilled direct practitioners to actually do their work? How do we create the conditions by which you can be successful, whether you're working one-on-one with a client or you're working in a community, trying to develop a youth empowerment and so forth. The second part about it, and I think maybe even more significant, is organizations are abstract concepts. You can't touch an organization. Organizations are people. And so if you're going to manage and lead effectively, you have to know how to work with people well. And therefore, I think that social work as a training ground is probably the best for helping people figure out how to establish powerful relationships with people so that we can help them be all they can be within their work. From looking at the macro level, I think organizations, certainly in social work and human services, have that responsibility to also engage with the larger social policy agenda and civic life. And one other way that I think I deal with it is this work we're doing at Del Mar Divine, which is a project I hope you'll get to know when you come here, where we're creating a space for local nonprofits to be better and trying to create an innovative, collaborative space. And I think part of what we're doing in that regard is helping build the human service ecosystem for the St. Louis region. I'll stop there.
No, that was excellent. Like, thank you so much for bringing your voice and your experience into the space, and also the transition to think about ecosystems. So one of the things that Elizabeth and I really like to do with students is to think about the social change ecosystem. That's not a concept that we came up with. Deepa Ayer, I think I want to credit her for that. But when you think about the ecosystem, that's what that micro, meso, macro is. There's a whole ecosystem in which humans interact, policies interact, our experiences interact, programs, services, organizations interact, the built environment interacts. You're going to learn a lot about that here. And what we hope is that you're really exploring what is your role in the social change ecosystem. And it's more than one. So bridging your strengths and your interest and the learning that you're going to do here to prepare you for service and being a bit of a change agent and being a leader in the social change ecosystem. All right, so my next question for our panelist is, from your perspective, how is the work that is being done at the Brown School uniquely making an impact at each of these levels of practice? And this point, we can kind of do the popcorn style, where if you go off mute, I know you want to add your voice to this and answer this question, and everyone doesn't have to answer it.
I'll go. Just yesterday, I was on the phone with another one of our alumni who is working, she was actually at JDMSW, and she is working along with a lot of her peers from Brown School in making life better for Native and people, Native kids under ICWA in Oregon and in Alaska. And in talking to her and in people from her class who have gone on, again, mostly macro students that I keep in touch with who have had my classes, they are all doing really interesting things. And they credit Brown School as one of the places they learned how to do policy. And she's coming to speak to my class next Monday on Zoom because she's in Oregon, to come share about what you can learn here and how she's using it to help kids mostly in the judicial and executive branches. So I don't think other schools teach judicial and executive as much as legislative, and we're lucky, I think, to have that here and to see the impact in the field.
I might focus one piece, because I think what Brown is really working on is community engaged education. One of the courses I teach, this Brown Consulting course, where we're actually working intensively with an organization to help them improve and understand how they can accelerate their work from a managerial perspective. And you'll find that in many of our classes, we're actively involved with community projects, working with organizations to try to help them solve problems. And then the school has a much larger agenda in terms of how do we engage the larger community. That's part of what the Delmar Divine Project is, why Washington University is part of that project. We're really trying to work with 30 organizations to really enhance their capability to provide high quality services to people who are dependent on them.
Yeah, and I jump in here as someone who graduated from Washington University and who continues to apply theories that I learned at Washington University. So one of the person that may teach you or you may interact with is Michael Sheladin. Michael Sheladin's theory states that when people own assets, they will think and behave differently. But also when people own assets, it will change their outlook on life, but it will also probably stabilize part of their community where they live. Because if you're a renter, you know that I'm here today, tomorrow I'm leaving. So you are less likely to engage in your community. But when you own resources in that community, you will think and behave different about that community differently. So that's partly the work, out of Washington University, out of Brown School. This is a theory coined within Brown School and by our own Michael Sheladin. And I've applied that same theory to do the work that I do, both in Sub-Saharan Africa, but also here in the US. And when you really think about it, that even when you look at some of our publications and some of the work we do, we don't do publications for the sake of doing publications. We really look at our work and really the interventions that we do, and we say, will they have an impact on the common person? So if I intervene with this person, that's at very, very small family level or individual level, how will then that affect the community where they live, okay? And then you can apply that in terms of theory. And then they just talked about a big grant that I got, that we got with colleagues with Dean McKay and others, that is really about capacity building. And I really believe that, I'm from Uganda, a very poor country, but the training that I received is not only impacting me as a family, but I'm able to give back to the communities that where we are working. And so when you think about it, that we got a grant, 5 million, and we are going to be training 10 people, 6 from the US, and then 4 from the developing countries. And the 6 from the US will be taken to developing countries to learn, to see, is there something we can learn from these developing countries? And we'll bring it back here. That really think about that you are not simply investing in this one individual, but you are thinking about what is the multiplier effect that this training this one individual will have on a community. And eventually, someone asked me one time, when will you know that iChad has arrived? When will you know that iChad has made an impact? I would say, when I see people we are training in leadership positions, when they're the ones driving policy, when they're the ones innovating at community level. So that work is happening at Brown School, and that work will allow, it's part of the professor that you are going to interact with, people who are really designing these kinds of interventions, and people are putting them in real action. So, yeah.
Absolutely. I put a couple of things. I'm trying to keep up with all the references and putting some things in the chat so that you're aware, but so many amazing things happening. Professor Samawala referenced Michael Sheraton's work around matched asset and IDAs. And I think he's kind of known as like the father of IDA and I remember 20 years ago working at Justin Peterson being one of the first in a trial with like using IDAs, individual development accounts, and thinking back on how far the research has come and the implications for it in the last 20 years. So thank you for that reference. Thank you for everything. Barry, did you want to? Yes.
Yeah, I want to just reinforce something Fred said about this idea of seeing us produce leadership. So that's obviously what social impact leadership is about. One of my big concerns is the quality of organizational management in human services is not what it needs to be. Some of you may have worked in organizations and were frustrated by poor management. And so part of what we're trying to do is to put people who have the skills to lead complex organizations, but come to it from the perspective of social work values and ethics, the theories that inform us about how we address human problems. And that's incredibly important, because I believe that human service organizations are best led by people who have our background. And as one other thing that to keep in mind is that our experience shows that wherever you start in social work, generally within 2 to 3 years, you're going to have some management responsibilities. So we're making sure that you get some of that content while you're here to prepare you for those roles.
Actually, but I wanted to say exactly that I was trained by someone who told me that whether I want to be a leader or not, for as long as you are in social work, within the first 2-3 years, you are going to be in a leadership position, whether you want it or not. So not to put in a plug for anything, but I think each one should take at least a leadership course of some kind. You should definitely be able to, yeah. And so, yeah.
I would definitely agree. I think coming out of the Brown School, probably within a 4 to 5 time period, looking at my colleagues in cohort and knowing that what you say is absolutely true, looking across the different platforms and saying like, look where we are now. So like you said, even whether you want to or not, you are probably going to be pulled into because of your training, your skill set, the way you think, what you bring to the work, to the organization. It's oftentimes a natural transition into leadership. Thank you so much. Yes.
Tia, can I chime in a little bit? I've just, was reflecting on the question as far as what is unique about the Brown School. And I just wanted to say that the Brown School really offers, we offer the American Indian Alaska Native concentration, which is not in a lot of schools out there. There may be classes here and there, but this is an actual concentration that the Catherine M. Booter Center is also here at the Brown School and has really equipped a lot of American Indian Alaska Native social workers to go back to their home communities and tribal communities to work. And I think that there's definitely at least one American Indian Alaska Native course that's offered each semester to fulfill those concentration requirements. And just to put a plug out there, in the fall, there will be the Indigenous Mental Health course, and in the spring there will be the Indigenous Knowledge, Cultures, and Values course. So those who choose the American Indian Alaska Native concentrations not only go back to work in their tribal communities, but they will be called upon to be leaders, as you guys are touching on. And this is important for Indian country. And the concentration is not only for American Indians, Alaska Natives, or Indigenous people. All are welcome to take the classes and to be a concentration in the American Indian, Alaska Native, because there's so many people, non-Native folks that work in Indian country and are part of the tribal court systems, the tribal foster care systems, in-home family work, both whether it's an urban setting or a rural setting. So all are welcome.
I really appreciate that, Professor Begay. Thank you so much. And also when you started mentioning courses, so this is a question I want to ask everybody, and I think you might have just answered it. So great way to set that up. I would love to hear, what is your favorite course to teach and why? And then how have courses you taught at the Brown School addressed the synergy between micro, meso, and macro approaches? So I'll put that in the chat, but what's your favorite course to teach and why?
That's like picking your favorite child. I feel like every time I like walk into a class, I mean, I'm not even being silly, but like, I'll be like, okay, this is my favorite class. And then like the next day I walk into another one, I'm like, oh, I love the discussion we just had. And I don't know how to pick that, but it's a good question.
Why don't you tell us one class that you teach?
Okay, so a newer one for me is Economics of Social Welfare, where it is an economics class, but it's not an economics class like you might take as an econ major. It's taking the major principles of economics and showing how we use those to make policy decisions. And the assignment in that class is to build up your own policy plan for a change you would like to see in the federal government.
Thank you.
So I also like all my classes, and I've mentioned Brown Consulting, but the foundation class for the social impact leadership is kind of unique. I co-teach it with our colleague, Heather Cameron, who's our endowed professor in social entrepreneurship. And we are so different in our backgrounds and in our personalities and in our approach. And what we're trying to do in that course is help students understand two parts of organizational life: the management of existing organizations and the development of new programs and services. And it's a lot of fun to see how we're able to sort of toggle back and forth and bring that in terms of, I think, a real life dynamic into thinking about organizations in a kind of a unique way.
And I teach several courses, but I'll talk about the program evaluation course. So the program evaluation course, I like it, not that I don't like other courses, but I like it because it's a course that allows me to bring in the field work that we do in terms of research, but also it allows students to get their hands dirty, that it's not theoretical. You don't just create data. I don't give you my data sets, but you are working on that course while you are in a practicum site. So it's a course that allows us to give back to communities where we are doing our internship, so that some of them, being a consultant is extremely expensive. I've consulted for World Bank, and they pay you very well. And so most of these small organizations, they don't have the money to hire a consultant. So when we design this course, we tell you, the evaluative question you are going to come up with, please work on that question with your practicum site so that you can leave a product behind that they can look at and say, yes, we are glad we had a Washington University student who worked on this, and now this is where we are headed. Either be it a needs assessment, be it process evaluation, be it an impact that they can even use for funding. So I like that course that way, but also it's a course that allows me to bridge global and domestic, because then some people are doing global, some people are doing domestic work. So it's a course that allows us to do that. So I love it that way. And the last thing that I'll say is that several students have used the papers, because you have a final paper, 15-page paper, but very good. They have used those papers to apply for PhD programs, to apply for work, to show their writing sample. So to use it, others have used it as a capstone of some kind. So I love it that way.
Yeah, and if I can just like piggyback on that, the vast majority of assignments you'll do, especially when you get to your concentration level, are not like busy work. It's documents that you would use in the field, papers you would use in the field, and a lot of them, you know, like Dr. Fred was saying, use them to apply for PhD programs, for fellowships, as writing samples to take into the field. You'll have written numerous policy briefs, all of this, and it's really nice. We try and prepare you to be successful in your interviews.
I'll go ahead and chime in here. So I work for the Office of Field Education, and I wouldn't say that seminar is my favorite class to teach. However, the signature pedagogy of social work is field education. And so what we believe is that how we learn social work is by doing in the field. And so what does that mean? How do we connect the theories from our courses to people? Because theories are nice, people are a little complicated. And so when we take those theories and we apply them to people, sometimes you're like, well, wait a minute, that's not how they said it might go in class. And so in seminar, we discuss what's happening in your practicum, and we talk about the challenges and how theories apply to human beings. And back to what Atia was saying before about the roles of social change, we spend a lot of time talking about privilege and sitting at tables, and how do we leverage our identities and our privileges when we have them to advance social policy change. And we spend a lot of time talking about roles and how those roles change over time. And so you can be, you know, so for me, I've had opportunities to sit at tables with, you know, police while we're planning for criminal justice reform for our Justice Center here in the city of St. Louis. And at the same time, I have taken arrests for abortion bans. You know, I've leveraged this privilege of a white woman in academia who's straight passing, looking to, you know, to sit at tables and to advance change and to look around and say, who's not here? In our learning agreement in the Office of Field Education at the Brown School, we added a racial equity component. From the summer of 2020, after George Floyd, our team decided we're going to implement this. We would like to know every organization that we work with. We want to train students to ask questions about who's impacted here. Are the clients at the tables making decisions? How do we assess every organization for advancing racial equity? And so that's my favorite role at the Brown School, is to talk about what's happening in the field.
Thank you so much, everyone. So now's the time of the program. We're going to set aside a little bit of time to also invite you, our students, admitted students, welcome to our community, prospective students who are maybe still thinking about coming to the Brown School. We hope you do. Do you have questions? So please feel free to raise your hand, take yourself off of mute, or put it in the chat. Any questions as we have this conversation? I'm going to check the chat to see this. Oh, great. We have a question in the chat for our panelists. It says, how can we frame out Indigenous population-centric policies where data mining is critical? Does anyone want to take the lead on that? How can we frame out Indigenous? And, you know, I'd love to ask if, I'm not sure if I'm saying it correctly, if Nandu Murari, that's such a great question, if you want to come off of mute and say anything more about your question.
Yeah, good evening from India. So I'm working since the last 15 years with the tribal and the indigenous population over here on the issue of oral malignancy, particularly cancer prevention and control. So what's my observation is that, so it's very, these populations are very hard to reach. So, and if we have to frame out some of these population-centric policies, and if you want this to frame out data or some policies at higher level, so we need data. But as these populations are inaccessible, so my question is, how, if we don't get the data and if the population is not accessible, so how can we frame out the policies where the accessibility is the major concern? Just like in contest with the Alaska people or the Native American Indian people. So the same here in India also. There are some pockets or some tribal population or the lower caste population which are living in rural areas. So these are inaccessible. Right. And if we advocate for the policies, then the policies maker will ask for the data or the evidence base, right? Evidence-based field.
I think this is a great question about the intersection, because you're talking about vulnerable populations that are hard to reach, and but we not only do we need to engage with them in terms of data, but also how does the data then inform interventions that are really helpful to them, right? And how do we preserve the integrity of that data? So I don't think any of our data specialists are on the call right now, but I do think, there's a couple different concepts at play right here in this question. Does any of our panelists want to chime in on either reaching vulnerable populations or, making data more accessible? Anything like that?
This is way out of my ballpark, but what I would say is I think that there's a wealth of experience here in terms of faculty and PhD students who have worked in multiple environments. And I would imagine there are some people who have had experience on similar kinds of problems that you could access. You just have the wrong panel for that question, particularly today.
And I would just add that, really looking at the actual communities that you were talking about and their role in what that looks like, and really looking at whether or not that is something that the community welcomes or doesn't welcome, so to speak. So just just looking at it from a couple of different frames of who is wanting the research done and for what purpose, and how can it get back to the people, and is it for the people? So that's just what I would kind of put out there.
Just to add to what Pam said, so in all the research that I do, and probably really look up Mary McKay's work, they are what we call community collaborative boards. And I think that the issue here is we really go into the community, we assume that we know, and just I'm piggybacking off of what Pam just said, as if we know it, that what they need, when actually we don't even involve them in the design of simply even the research, the design, and for them to be our consultants. So Mary McKay has done a lot of work around what they call CCB, community collaborative boards. NIH funds that work because they believe that from the conceptualization to the implementation, and these board members need to be paid. They need to be paid just like Fred. And then they also need to be engaged in terms of data collection themselves, okay? So it's not simply people come in and give you whatever and you leave. And then on top of that, you need to engage them in the dissemination aspects because they will let you know exactly. So I think read around CCBs, community collaborative boards, and how community collaborative boards are used in research, are not simply Casale, but really used in research. That's one approach. Then the other way, how to get to some of these hidden populations or some of the populations that may not, in research, there are different methods. You can use snowball method. A snowball that you get one seed, and then, someone may say, yes, my colleague, because they know the community better than us outsiders. So there are several ways that you can do that. And in terms of accessing data, NIH is coming up now with a system where data has to be publicly consumed. So because, at least I'm talking about NIH, where we are funded by federal dollars. So people should have access to our data, provided you remove the identifying information and people can't be traced and that kind of stuff. So I think there are several ways, but I would read up on CCBs. And the good thing goes back to Atia's question earlier: how does the work that we do here at Brown School impact whatever? Mary Mackay is here at the Brown School, and she wrote the CCB, and there's a full book on that. So
yes, thank you so much. Absolutely. And I think you're absolutely right. There's a lot of intersections here with the skills, how we approach our values, how we approach this work, not just a set of hard skills around like data mining, but the skill set around how we engage with people, but our values and the fact that we center equity. And that's the way we're working to center equity in all that we do. And this is an opportunity for that. Also, Liz said something about, isn't data gap an issue between all three levels? Yes, and an opportunity, because data is always evolving. And because these roles are always evolving, the opportunity is for us as social workers to help bridge and weave between those systems to help like what data is going to inform what action and policy. I always say become a resource. Like if you're going into advocacy, policy, organizing, then you need a wonderful network. You need this network. You need these professors. You need your colleagues. You need a transdisciplinary network of people so that there's someone here who's helping to mine the data. There's someone else who's helping to translate the data. And maybe it's your role to then use that to inform policy development and reform. So I think that gap you may see in how data is communicated across the three systems is the opportunity for social workers. Okay. All right. So we're almost.
May I ask, is it Liz kind of question, just so that clarity? Is it the gap? Is it because of absence of data, or is it because the data may be there, but we are so siloed that who has it, they don't share? Is that what, because you said, isn't the data gap an issue? Is the gap really that there's no data? Because I always think that really we have a lot of data, but people maybe have personalized that data and we don't share that data. Or is it that these issues don't have data and we need to collect new data?
Yeah, I think that I was speaking more to the ways in which there's a lack of communication between the levels.
Thank you.
Thanks, guys.
No, thank you.
Absolutely. And I think you're right. And I think that's a prime opportunity. This is a space that I've been in parts of my career where being the bridge, the communicator, the catalyst, and to amplify, being able to amplify, wow, this is knowledge that was constructed, maybe very collaboratively, it's informing practice, evidence-based practice, and yet it's not reaching everyone that it needs to reach. So how do we amplify? That's a very significant role for people in the social work profession. So we're at time almost. I have a lightning round question for for this wonderful group of faculty that joined us today. You can answer either question. And it's, why did you choose to come to the Brown School? And I think some of you have actually answered this a little bit, but what advice do you have for incoming students?
I'll go first.
Go to Barry.
Go ahead, Barry.
I'm sorry, ma'am. You go first.
Okay. I think that as a clinician, I think that if any of you are on the clinical mental health track, start looking at your state's licensure requirements now and getting very familiar with that. And when you come here, we'll be able to help, guide you, and you'll have faculty advisors that are clinicians as well, or have been in practice, that will be able to help answer some of those questions. So that's my one piece of advice is, if you're on the clinical, you want to be in practice, look at your state licensing guidelines. And just so you know, it's okay to not be 100% sure exactly where you want to be. Like I said earlier, this is such a vast and open field that it's awesome. So I welcome all of you, and I'm here. So when you get here, you can come seek me out. Go ahead, Barry.
So I came here after I retired from my other life because my wife works upstairs and I wanted to be closer to her. But my piece of advice to you is this is a demanding program, and many of you will also have jobs and so forth, and there'll be a lot of stress. You have all mastered going to school, okay? And so that if you've been accepted, you know how to be an effective student. And so you have to do that coursework. But my big concern is that social work students sometimes start to live within the brown bubble. University is filled with extraordinary opportunities for learning in all of our schools. The community is very vibrant. There are all kinds of things. Be outside, right? You have to be inside, but be outside. Find your ways to multiple connections at the university and in the community.
Mm-hmm. And can I piggyback off that? So I'll tell you why I came to the Brown School, but it's also going to be advice. This is one of the top rated schools of social work that also, because they all don't, has a deep entrenched policy focus. You can also add a law degree. If you get into the law school, you can add an MSP, a Master of Social Policy. And I think that where we really focus on all three branches of government, it's different than any other school of social work out there. The other thing that I would say, like Barry, is just because we have all those classes here, don't stop. Go lobby in the state capitol, take a practicum in the state capitol, like work in municipal government. We have connections to all of those places, and we can set you up so you leave here not just having a really deep exposure in the classroom, but having a community exposure as well.
Yeah, having come from a poor country and having lived in one of the most expensive cities in the world, New York, let me speak, because Brown School definitely top ranked. So I know that you guys know why you applied, but maybe you are still doubting St. Louis. St. Louis is a great city to live, very affordable, a lot of free things to do. So as you even engage with work in terms of school, please, like Barry said, you go out to WashU, but also go out and enjoy the city. We have a great zoo. We have a great forest park. We have great, it's a great city to live. So for me, very affordable, very easy to live, and really the community that it really helps us to live, so some of us, it reduces the stress of being in academia. Really, of course, you know, the city gave me my wife. My wife is from St. Louis, so that's a plus. So yeah.
And just to add one other thing, in St. Louis, we pay for museum in our taxes, so almost every museum is free. You can, if you just want to go into the art museum, it's not $40. You just walk in and enjoy. And that's something that you can do just to fulfill yourself that's different than other cities too. The zoo is free. All of this stuff you can just go enjoy.
Yeah, absolutely. And Elizabeth. Yes, Elizabeth.
I just thought I'd add the advice part for incoming students. Graduate school is supposed to change you. That's the point. That's why you're coming here. And change is uncomfortable. And growth is necessary. So know that while you are here, you will experience that change and that discomfort, and that's the point. And we will support you through it. We will support you through that learning, through that discomfort, so that you can grow through and learn. Let it break you open. Bring your tools, know what those are, so that you have those already organized when you get here. But looking forward to connecting with all of you. Thank you.
Absolutely. Can everyone join me in thanking our faculty for sharing such wisdom and candor and their experiences? And we appreciate you joining us for this conversation. We hope you have a wonderful rest of the Admitted Students Week. We'll see you in the fall.